Good morning and welcome to this expert panel discussion in a webinar format on radionuclide or nuclear medicine production and use in Australia. My name is Michael Sheldrick. I'm from the Department of Industry, Innovation and Science, and I'd like to welcome our panel members here today, and I will introduce them shortly. I'd also like to welcome those people out there watching the webinar. We know that we have people registered to participate and watch, and I'd also like to say welcome to the people in Corn that have gathered there to participate in the webinar. Now, before we begin with the topic, I think it's worth noting the context for this webinar on nuclear medicine production and use here in Australia. For some years now, the Australian governments have been working to bring a solution to Australia's existing radioactive waste inventory and our future inventories. My team is responsible for implementing that action, and in that process we have been talking to communities around Australia through the site selection period and beyond, and in those discussions with the communities a lot of issues are raised with us. Many of those issues obviously go to the safety and other aspects of the facility. They go to the questions around siting it and how we're doing that. But also, for context, a lot of people in the discussions also are aware of different views and different discussions and information out there around the sort of technologies that we want to talk about today. And what it does do is it raises questions around whether or not there's a need for reactor technology going forward. Also a question of whether some of the approaches that we're taking now will supersede the technologies that are used, and what are the then long-term consequences for waste production in Australia and the need for a facility. So in that context we wanted to do this first webinar. It's important for us when we're engaging with the communities that information is factual and accessible, and we hope that the process today will provide that opportunity for everybody. Not only today, but the information and this webinar will be available on the internet after today, and so it will be available for everyone to look at. So in that context, we intend to have the discussion around nuclear medicines and reactor technology. We're not intending in this forum to talk about the siting and those other challenges that are obviously important for communities in Australia, but we may get to those in a later forum if this process works well for us. But as I said, the main purpose today is to provide accessible and authoritative source of information on what is a really complex issue for most people in Australia, but frankly for the people gathered in this room today, very much experts in this field, and I think we will get some great insights. So I'd like to go around the room and introduce those people who have so graciously given their time to participate in this and help inform us in the department, and also through this process help inform people in the broader community. So I'll go around the table, and on my immediate right is Professor Hossein Kiat. He's a medical director, and I think it's worth going through in a little bit of detail the CVs of the people around the table, because it's an impressive collection of people, and I think understanding their expertise and where they're operating, where they've come from is useful for everybody. Some of them will be well known to many of you, but I will go through each one. So Professor Kiat is the Medical Director of Cardiac Health Institute and consults at the Epping and Sydney Adventist Hospital Suites. He's a Professor of Cardiology at Macquarie University, a Professor of Medicine at University of Western Sydney and the University of New South Wales, and a Professor of Nuclear Medicine at the Charles Sturt University. To his right is Dr. Adi Patterson. He is the CEO of Australia's Nuclear Science and Technology Organisation and has been in that role since 2009. He's a Fellow of the Australian Academy of Technological Sciences and Engineering, Engineers Australia and the Royal Society of New South Wales. To his right, Dr. Peter Karamoskis. He's a radiologist and a nuclear medicine physician at Epworth Hospital in Melbourne. He's a public representative for Radiation Health Committee and a member of the Nuclear Safety Committee of the Australian Radiation and Nuclear Safety Agency, otherwise known as APANSA. And he was also representing the Australian Conservation Foundation. To his right, Dr. Jeff Curry, Associate Professor in Medical Radiation Science at Charles Sturt University. He has professorial appointments at Charles Sturt University, Macquarie University and the University of New South Wales, and at Regis University in Welling, Jesuit University in the United States. He undertakes research in the clinical utility of nuclear medicine and radiopharmaceuticals. His research has included international collaboration on radionuclide production with cyclotron technologies. He's also representing for Matt Ayres, who is a co-founder and executive for the Rural Alliance in Nuclear Scintigraphy, and that is a support network for rural and remote nuclear medicine professionals. I will skip past Lynn and I'll come back to her shortly. Dr. Margaret Beavis is a general practitioner and is the president of the Medical Association for Prevention of War. She also teaches clinical medicine and public health at Melbourne University and is a senior examiner for the Royal Australian College of General Practitioners. To her right is Professor Dale Bailey. He's the current president of the Australian New Zealand Society of Nuclear Medicine. He's also the principal medical physicist at the Royal North Shore Hospital and professor of medical radiation sciences at the University of Sydney. And on the end of the table, Associate Professor Barry Ellison is the Director of Nuclear Medicine at the Illawarra Shoalhaven Area Health Service. He has over 30 years of extensive clinical experience in all disciplines of nuclear medicine, including general nuclear medicine, cardiac nuclear medicine, CT, coronary angiograph and PET scanning. And also, I'm very pleased to introduce Francois Couillard on a video connection from Canada, graciously giving his time late afternoon for himself. He's the current CEO of the Canadian Association of Medical Radiation Technologists. He also currently serves as the president of the board of the Ottawa Community Immigrant Service Organisation and on the management committee of Canada's Organisation for Health Action. So welcome everyone on the panel and thank you very much for your time. And now I'll just come back to Lynn Angel, who's the moderator for the day. Associate Professor Lynn Angel is the Deputy Dean and Faculty of Science in the Charles Sturt University. Lynn's academic career has seen her develop professional standing in areas of education, medical science, pharmacy and ethics, reflected in her publication output of over 50 reports in the categories of education, medical science, pharmacy and ethics. So again, thank you all. That's a long introduction, but I think it's worth recognising the credentials that the panel brings here today. It's an important discussion, as I said, for us in the department to better understand some of the issues that permeate through this discussion about managing Australia's waste, and I hope the people listening and participating online and subsequently watching this get something out of the panel session today. So with that, I'd like to hand over to Lynn, who will go through the rules and the agenda and facilitate the meeting. Thank you very much.
Thank you, Michael, and thanks for that very warm welcome and for introducing all of the expert panel members. As Michael has indicated in his introduction, I'm here as a non-expert moderator for today's session. And as we'll need to stick very closely to time to get through our schedule for today, I'll try to model that as I outline the approach and the expected outcomes for today. So from the outset, can I stress what Michael has already provided the context for us, that this isn't about the National Radioactive Waste Management Project itself. Myself nor many members of the panel have been briefed around this process. So it really is about sticking to the core issues of trying to look at the facts around nuclear production. So the questions that have all been developed for the themes for our sessions today have come about from public debate and conversation and meetings over the last probably 12, 24 months. And so it is really important today for the to draw on the expertise of our panel members to try and stick to getting those core facts out in the community, because without that it's very difficult to go to the next stage of where in fact the project itself may take us. So we are hoping by the end of each session to have reached a level of consensus around each of those themes and questions. And so it's my intention today to keep each of the presenters in the discussion focused on the themes before us. To ensure that we do fulfil this purpose, I do wish to go through the rules of engagement, which will include adhering to time. I'm hoping that the presenters won't actually race through their 5 minutes of presentation. Many of our listeners will be lay people in the community, and so it will be really more constructive and helpful for the purpose of this webinar if we're able to pace the presentations and so people can absorb the information that's been provided for them. All the discussions, including the 5-minute allocated time, will be kept to topic, and if that is found to be wandering, I will move the agenda on. At the close of each session, I aim to check in around the panel to determine if we've been able to reach a level of consensus. And I guess the core thing for me is that at all times I want the discussion to be kept professional and respectful. Remember that the discussion is being recorded in full and it will be available in full and edited into the individual sessions. The discussion is being transcribed. It will be sent round to the panel members for potential and opportunity to correct any errors of fact, and then it will be accessible for members of the public. So I think this is the useful output from today, is that such information will be there for people to access repeatedly. And if in fact, as Michael has indicated, we feel that this has been a useful process, then there may be more webinars in the future to be able to take us to the next level of discussion. So can I just check in with the panel members if there are any points of clarification you'd like at this stage? Everybody happy? For our live stream viewers, please be aware that there are links on your screen that will allow you to send in questions or comments. Clearly, as we're going live, and some of the sessions are going to be very tight with the presentations and the length of time we have, but we will do our best to respond to relevant questions and comments that come through. And certainly those that don't get directly answered will be taken away and looked at, and if relevant to this topic, we'll do our best to be able to provide some level of response or comment back when everything gets recorded and out there for public access. There'll also be an opportunity for a poll at the end of each session. So if you're able to access that, it gives us a bit of a sense of how the viewers are actually responding to the information that's been provided to you.